Successful matches, and that's what we're focusing on our Feel Good Breakfast show. Well, the other thing that we're talking about this morning, and also taking your calls on 08391333728, is we're talking about allergies, infections, and especially germs. It is spring, and what a beautiful time of the year. But it's also the time that viruses and everything else around us. So Dr. Darren Green is with us this morning to talk about this. Doctor, I've got a few questions around this, injections, how to prevent it. And it seems like we have a caller on our line as well. You're live on your Feel Good Breakfast show. This is Expresso. Who am I speaking to?
You're speaking to Stanford.
Stanford, good morning. Where are you calling from?
Mitchell's Plain area.
Okay, so what's your question this morning? Doctor can hear you.
Well, I've got a sister that's got a problem with sinusitis, according to the doctor, but it has become so bad that she has itchy eyes, and basically to the point where she cannot really sit still but kind of scratch, not scratch them but rub them, and she wears glasses. So now I've heard about two other people that also wears glasses and basically had the same problem. So it comes across as being pink eye, but it's basically itchy in the sense that she has to lay back and scratch her, rub her eyes.
Right.
So it becomes swollen after using the medication that she has been prescribed.
Okay, well, thank you so much for your question. Doctor can hear you, and just keep watching your screen. We'll answer it for you. Well, there you heard the question. It seems like, I don't know, an allergy?
Good question. Definitely sounds like an allergy, obviously, triggered by something in the environment, but it's a little bit more complex than that, because you have conditions that are called conjunctivitis, which are triggered by things like allergies. You get bacterial and you get viral conjunctivitis, which is highly contagious. In other words, if you touch your fingers and shake someone's hand, they can get it as well. He mentioned pink eye and stars of the eye as well. I think what's important here, obviously, is the course and the progression of the disease. Does this happen seasonally as we go into a season when there are concentrations of triggers in the environment, pollen, etc.? Or is it something that's happening continuously? Sinusitis as such is a complication of chronic upper respiratory tract infections, but also chronic hay fever and allergies that is not brought under control can lead to congestion of the sinus and then facilitate an environment for the hojas to grow in. But for this patient, with the eyes particularly, one would certainly be interested in conjunctivitis as a cause, and if the allergies are triggering the itchiness, very important to address, obviously, the environment and put on to preventative therapy. In other words, something like an antihistamine every day that's non-sedative so she can function in the day. The problem with these patients is that they rub their eyes so much that the hairs in the upper eyelid actually scratch the surface of the eye, and you get what's called corneal abrasions, which can cause complications in vision later on.
And there you heard it. Don't rub the eyes, and definitely seek some medical attention. And Doctor, thanks so much for joining us this morning. Stay with us, Dr. Darren Green in our studio taking your questions. Thank you so much for also giving us a call on 08391333728. Well, while Doctor stays here, there's a lot of other stuff happening on the show. Katlego, what's happening?